Hey, Dr. Greg Thompson with the Southeastern Institute of Restorative Medicine, giving you your functional medicine update for the week, and we'll give you more. And for those interested, we have a live Facebook lecture coming from Magnolia Lace Boutique in Chipley, where we're going to be launching our functional medicine concierge. We're this week solidifying our advanced biomarker lab testing and genetic testing. So we'll be having some prices for you by the end of the week on that. So Dr. Casey Means is the new Surgeon General nominee by President Trump. And, when you look her up, highly qualified person, was in her 5th year of ENT residency and decided that what she was seeing in the approach to medicine was disheartening, and decided not to finish, after 4.5 years, not to finish her 5-year residency, and then got into functional medicine. And when you look up functional medicine, you say, oh, it's alternative medicine. And the reality of the situation is that functional medicine is not alternative medicine. It's regular medicine taken to its logical extreme, remembering all the biochemistry that we were taught in med school. And I'm just going to give you some great examples. My first case was back in 2012. Moved to teach at a new medical school. No, I lied. Oh my gosh, 2006, way back when. One of the members of the church came up, and her daughter was having terrible bone pain. She had seen no less than 3 different orthopedic surgeons. And at some point they were telling her that it was all in her head. Terrible pain, constant, was on crutches, and mom was concerned. She was headed for a wheelchair. They saw the regular family doc, said, oh my gosh, I think this is really a psychological case. She was, and looking at her, she was a few pounds overweight. She was very pale. And just 4 questions made me diagnose her. And so the 4 questions were, how much milk do you drink? None. Cheese? No, I hate cheese. How much do you get out in the sun? I could tell she got no sun whatsoever. Did anyone bother to do an x-ray? Yeah, and they said that it was kind of weird, but nothing to speak of. Okay, weird. Huh. So, and last question was, did anyone ever check your vitamin D level? So, rickets is a disease that requires a blood level of vitamin D to decide whether or not it's a possible disease. So, you could call it alternative medicine, but no less than 4 doctors had missed what was painfully obvious. This was when I was in Tennessee. I then began, based on this one case, asking all of my parents about their kids, and literally diagnosed vitamin D deficiency in no less than 20 people over the next 4 months. If you're putting on sunblock all the time, if you're one of those people who doesn't do a lot of dairy or take a vitamin supplement, especially vitamin D3, not D2. Remember, D2 requires sunlight to convert it to D3, which is the active form. We talked about vitamin D before. It precedes the formation of cholesterol and a huge bulk of hormones that come from cholesterol. And it's an anti-inflammatory. It prevents osteoporosis. It's important in autoimmune diseases like multiple sclerosis, and you can also see some significant cognitive issues, depression, with low vitamin D. But nobody bothers to check vitamin D. So we can yell at them, we can scream at them, we can say, yeah, it's alternative medicine, but the reality is, in fact, in Tennessee when I was there, the Children's Hospital in Knoxville actually tracked me down and said, why are you having so many kids get their vitamin D levels checked? And I told them, and then within a year, it was a standard protocol at the hospital because so many folks were vitamin D deficient. And in the adult population, I can only think of a handful of people who have come in for hormonal supplementation, estrogen, testosterone, who's low, whose vitamin D levels aren't in the toilet. So I would say most vitamin D levels are low, but vitamin D has been shown to be a precursor for prostate cancer, breast cancer, and then a whole host of inflammatory conditions, especially pain. So, big one. We can talk about the B vitamins. You've already heard me talk about the methylated B complex, especially in folks who have higher MTHFR or have the MTHFR. They have higher homocysteine levels. They have issues converting or methylating And those things create significant issues in regards to anemia, neuropathies, cognitive issues, fatigue. So does anyone bother to do checks for those things? No. So again, is it alternative medicine to know your genetics to see if you ought to be taking a B complex? Okay, I guess so. If you want to say that's weird or alternative, when a third of the people, or up to 40% of the folks, may have that issue in converting folic acid to B vitamin, same thing. B12, same thing. Cognitive issues, and anemias, and so we got the methylfolates, we got the B12 issues. Crazy. Omega-3 fatty acids. Most people who are living the life, la vida loca, who are doing too many carbs, too much fatty meat in association with carbs. Remember, fatty meat's great for you if your carbs are low, keto. We talk about carnivore, Mediterranean. You're eating the good fats, the low carbs, lots of whole fruits and whole vegetables. Then the likelihood of inflammation and persistent pain is much less. With the fatty acids, it's been implicated in Alzheimer's, chronic inflammation, pain. So, EPA, eicosapentaenoic acid, 3, DHA, deoxycholic acid. Pentanoic acid. There we go. I knew I'd get it. That ratio of 3 to 6 is really important. If you're living on the meat, you're living on the legumes, the DHA, the omega-6s are too high. So we need our omega-3s, our omega-6s in a ratio. I like the 2 to 1, give or take. Again, inflammation, immune issues, general sense of well-being definitely has been implicated in increased cytokine formation, and even there's some issues on brain health, post-traumatic brain injury, TBIs in athletes. Very important. Keep up your omega-3s. Iron deficiency? Well, God, that's alternative medicine. No, it's in iron deficiency anemia. It's not uncommon, more in women, especially if their periods have been crazy and nobody bothers to check why they're tired. Well, they're tired because they might be anemic, and all anemia is not iron deficient. So just because you're anemic, you need to get an iron profile before someone throws you on iron, because it may be a B complex issue. And so the size of the blood cells, so if you're anemic and the size of your blood cells are larger, that's more implicative of a B issue, B vitamin issue, either folate or B12s. And then if your cells are real tiny and your bone marrow is holding on to them longer, then it's more likely to be an iron deficiency anemia. Now, that may be one, you may be iron deficient, but you also may be iron deficient because you're bleeding somewhere. It may be microscopic bleeding. People in over 50 years of age who haven't had a colonoscopy or have black tarry stools, that's part of their workup. You can't just say it's iron deficiency. You can't stop there. You need to make sure that they're not losing blood chronically. So women perimenopausally, heavy periods, one of the deals that we do ablations of the uterus is to get them to stop bleeding if they have fibroids or they're bleeding all the time. Okay, that's all fine and good, but you also might want to check why they're bleeding all the time, which can go back to some of the B vitamins that we're talking about, the mother gene. All of those things are important. Keep in your mind, it's rarely just one thing. Had a great conversation with the nurse practitioner who came in today, who recognizes, thankfully, and she doesn't do functional medicine per se, but she's clearly quite bright, that it's not about just throwing medication at people. It's like, why are you anxious? Why are you depressed? Why? Well, I'm stressed. Well, okay, great. But do you have deficiencies that may be part of what makes you more easily stressable for it to manifest itself that way? Because if you have a weak constitution, kind of an old phrase from the old days, that weak constitution may be that you have a vitamin deficiency. And so that if we fix that vitamin deficiency, you have a stronger constitution, which allows you to be less easily stressed and more durable when it comes to the stresses of life. Iodine deficiency is one of those beautiful ones that no one ever talks about. If someone's got goiter or they got hypothyroidism, well, why are you hypothyroid? Sometimes it could just be a simple bit of iodine deficiency. And using iodized salt or sea salt could make all the difference in the world. We don't necessarily have to just throw hormone at somebody because their thyroid panel's a little off. Again, you have to look at immunologic reasons. Oh, my thyroid's off. Well, I mean, I would say half the people who come in who have hypothyroid have no idea whether or not they have antibodies, which means they might have Hashimoto's, which means it's an immune issue, which means there's a micronutrient issue of either iodine, selenium, zinc, and or that they have some sort of immune problem like a celiac disease or a gluten deficiency or a gluten intolerance. Not uncommon, run into it all the time. Again, alternative medicine? These are diagnoses that when you go to the books, the internal medicine books, and you start reading about this, you see all these nutritional deficiencies. This is not alternative medicine. It's just, it should be part of the workup rather than, oh, I know what to write for that, so here's a prescription. I mean, and again, I say that flippantly, and I know that doctors don't do that, but the number of people who come in who haven't been checked for these things, who are being treated for, well, lady comes in today. She came in for a platelet-rich plasma injection in her hip. She'd received no less than 3 separate steroid shots into her hip, into her back. She's got this pain running down the back of her leg all the way to her heel. Classic sciatica. CAT scan didn't really say anything, or MRI says maybe there's a bulge. Oh, we should probably think about doing an epidural. Why? Do an EMG, do an electromyographic study to see if the nerve is actually being impinged upon. Why just throw steroids into in this case, into her back, or if you've got knee pain, into your knee? We already know, and it's in the literature, that we know steroids make knees worse. It makes you 10 times more likely to need a knee replacement. From the first injection you get into that knee, 7 years down the road, you're going to need a replacement. So platelet-rich plasma, exosomes, the biologics are possible things. Why does Tom Brady and Peyton Manning and Jack Nicklaus leave the country to get stem cells and then not have surgery? Well, let's see. There might be something to that. Is that all alternative? Yeah, maybe the stem cells, because we're still working on it, but stem cells are highly investigated at places like Duke and the Mayo, and they're using them. There's a couple of places in Florida who are doing stem cells in the back and not needing surgery. So, we call it maybe alternative, or we call it functional medicine, but the reality of the situation is that what we might see now as alternative, in a couple of years becomes standardized. So, one of my favorite things when we were talking, to students was, if you look at right now, and we look at the standard of care, and then we look back 20 years, if somebody is practicing right now what the standard was 20 years ago, it's malpractice. Why? Well, because things have progressed, and because we've gotten smarter, and because we're seeing things that we just don't throw stuff at. We actually want to understand it. So, it's like the inventive AI. Yeah, some people hate AI, but man, it's making life a whole lot easier, but it's making you smarter and be better able to make decisions. So it pains me to hear, when people are saying, oh, Casey Means, she's been working about nutrition, and she hasn't been practicing real medicine. Well, she was a surgical resident for 5 years. She clearly understands what real medicine is, and that she wants to nutritionally attack something before we blindly throw medications at. Simple question. How many people over 50 do you know that are on 1 medication, 2 medications, 3 medications, over 60, 4 medications, 5 medications? We just keep throwing medications at it. Someone's got some, and I'll end with this because I know I'm going long. Someone are having pre-diabetes. What are we doing about their carbs? What are we doing about their sugars? We're just throwing methotrexate at them and calling it good? Well, what are they doing? So now the diet for pre-diabetes isn't the most important thing? No, it's the most important thing. It's not about controlling your sugar with a medication. If I'm eating badly and this thing is my salvation, I'm not fixing the problem. You can't cure somebody with methotrexate. Can you fix pre-diabetes and type 2 diabetes with diet and weight loss? Everybody nod their head yes. Can you fix it and cure it with methotrexate? Everybody shake their head no. It's not alternative medicine. I mean, we can call it that. You want to say, okay, it's alternative medicine, fine. It's not alternative medicine. In the old days when people were having anemias and were poorly, were sickly, and had poor wound healing, and, well, maybe they have scurvy. Maybe they're not getting enough vitamin C. Maybe they're not, maybe they're not eating right. So a lot of the diseases of today, while we say that they are, biochemical results of a lot of things, which is true. It's also that if your environment is poor, if your soil is not fertile, you can grow plants and you can grow fruit, but I'm going to pick the fertile soil every single soil. I'm from the west. No, south, I guess. I guess that'd be south. I'm going to pick the fertile soil every single time. Every single time. Because it gives me the best chance of overcoming the issues, of needing less medication. Maybe I can't go without any medication, but maybe I'll use less medication on my way to dying to live. Okay? So Greg Thompson, functional medicine. I don't think it's alternative. I think it's a common component of traditional medicine that is the perfect marriage made in heaven, that we assess your genetics. We assess whether or not your gut is digesting food and absorbing nutrients the way it's supposed to. That you're not just throwing supplements at you for the sake of throwing supplements. Oh, I'm taking 27 different supplements. Well, that's just crazy, because I want you to be focused and specific on why you're taking each of them. Why do you need them? We have to make sure of that. Again, absorption issues. You have an immune issue. You have a neurologic disease. Have you maximized the vitamin supplements and the mineral supplements that have been shown to be useful in their treatment? Well, who doesn't want to take half as much medication as they might be? How many people come in and say, yeah, the medication does this, but it makes me feel less? Well, if you take half as much medication and you don't feel half and you feel better, then I would say that was a pretty reasonable thing to do. So Casey Means, hate her or love her, because she's been involved with nutrition, because she's been involved in the past with industries that RFK is a big fan of, as far as trying to get rid of food dyes, trying to put more nutrition into our food supply, trying to reduce reactions to environmental toxins, trying to make sure that there's nothing in vaccines that creates an issue other than what we're trying to do with them. There's nothing wrong with investigating. Anyone that tells you, all the information's in, it's not that. They got something to hide. I'm sorry. Investigate away. Because if you find something, then you're suddenly smarter. And I'll just use that last thing we talked about, the new essential fatty acid that was found by the Navy, C15, and its role in with or without in combination of high fructose corn syrup. Add C15, stops that progression, prevents further deterioration in the liver. Who knew? Comes from milk. So add butter. Again, not on toast. No butter and jam on toast. If you're going to have your butter, put it on your steak, and then have some nice lean vegetables with it. But don't have your carbs with it, because remember, carbs are going to spike your insulin. Insulin's going to decrease your fat absorption. I keep throwing that in. Why? Because I'm not preaching to the choir yet. Some of you haven't joined the choir. I want you to join the choir. Come see us, Southeastern Institute of Restorative Medicine. The big launch this week on functional medicine. We'll have those folks who want to come and be part of that. Greg, I want your number in my hip pocket. I want to be able to see you a couple times a month for whatever. Then we've got pricing specifically to that. We have discounts for couples and families. Or if you just want to start doing it, we've got pricing in that. We'll have the new blood testing for the biomarkers and the genetic testing. Well, we should have all that up and running maybe by the end of the week. Hopefully, certainly no later than the beginning of next week. I've already made all my contacts and we're getting set up. Now we just have to put the protocols in place here at the office. Greg Thompson, live a vital life. I want you not living to die, but I want you dying to live. And you may never come to see me. We may never meet in person, but just look up the stuff I'm talking about so that maybe it triggers one neuron that makes you change your life, which is all I want. For the better. For the better. That's what we're shooting for. Greg Thompson, signing out. Have a great night.